Good afternoon, dear members of the Presidency, to the author of the book, and to the organization. I first of all would like to thank for the NIPO organization to invite me and sharing my experience with you. I think that this is something that is very important because the intellectuals is part of the society to have to mobilize the entire society according to present problems who will affect the entire country. So then I congratulate first the organization having conscious of the role of intellectual and the role in the society. Second, I would like also to congratulate the professor and the research that he has done in the book, the effort to bring his experience or what he has been studied up to the public light and to illustrate it for the common people. Because many phenomena happens in the science, but sometimes people remain without knowledge and without active participation because knowledge is a privilege in our time. There are a lot of information, and then we have to start discharging what to use, what not to use. So what is useful? So all the efforts to bring the knowledge to the masses is a matter to congratulate the author and the people involved on that. There I was thinking when I was invited to talk to you, what could be interesting for a specialist, for professionals that is not my field to present. And then I say, well, I will point out some Cuban's point that is very peculiar, and then I will reinforce the idea of the author and this organization that this is a matter of concerns everybody. All we have to work together in health and prevention of dengue and also other diseases that the humankind think that it had been disappeared, but they are rebirths with stronger, with more deep causes sorrows for everybody. I have to start mention that the merit of founded the mosquito as a vector of transmission of disease is an oeuvre of a Cuban doctor. His name is Carlos J. Finlay. And as a politician, as a Cuban, I have to say that unfortunately, his period of life was at the beginning of the 20th century. He used to work for the American Navy base in Cuba, Guantanamo Navy base. And from there, he became famous among the Cuban because he was a very humble people serving the real Cuban population. And with what he learned in his university, he came and put in practice with the Cuban. But as he was in a team, and he found out that the mosquito is a vector, but the leader of the team was an American doctor. So the entire community and medical community knows about the mosquito as a vector transmitter as a discovery for an American doctor. But in fact, those who work with the Cubans group or made a test, even with his own family, was a Cuban doctor. His name is Carlos J. Finlay. So I pay homage to him as one merited, and the Latin American country recognized his date of birthday as the Latin American medicine, because this is a retribution of his hard work and contribution to the knowledge in the medicine field. The other thing that I have to say is that dengue as another disease also has a political field. It shouldn't pass without a political consideration. And I will tell you why. For example, last year, Sri Lanka had taken place a conference about the United Nations linked with the malaria program. Among the representatives of that was one Cuban representative came. And when they were in the discussion, which are the countries who deserves the amount of money, unfortunately, some European delegates considering that Sri Lanka do not deserve the amount that you have to receive as a third world country as Cuba, because there was some consideration in the program of AIDS that they think that it should block the assignment of funds for Sri Lanka. So then my representatives say, if according to the principle of the medicine, you couldn't block any program who goes for massive people, a massive group, because of consideration of minor sector that could be AIDS treatment, of AIDS patient treatment. And we blocked the political action against Sri Lanka. This we did with a lot of solidarity sense, but also with the convince that it is unfair because of some traditional considerations or political motivation in the way that you take care about AIDS patients. The Sri Lankan entire population should be affected in the malaria, dengue, etc., programs control. But these small details are details, give an evidence that the political decision, also political consideration, are now affecting the organizations around the world who are dealing with the health of many, the majority of the humankind. Also, for example, some rich countries, they could be placed Singapore, or we could place Italy or France. When we go for the debate in dengue matters, they consider that these are not their priorities. Why? Because they are not tropical country. But what happened now? That they found dengue cases and malaria cases in France and in Spain, because those countries have high number of immigrants coming from Africa. And sometimes there are people who are living all their entire life with those viruses and they survive. But when they change the status of life, the economical condition of their life, so the disease coming up with a strong illness and the transmission to other European contexts that they are not in vaccination or in contact with the disease, it is fatal disease. And doctors there are not ready to face a reality as could be for our doctors. So what I wanted to transmit is, when it's concerning of the health of everybody, you shouldn't say, this is not my case, second category. Because you don't know when will be the moment that your population will be in contact with other populations affected. And so recently, for example, in Cuba, we are helping Haiti in their control of the cholera or their dengue disease. What will have happened? That the Haitians that were flooded with a lot of death because of earthquake together with the malaria used to throw their bodies to the sea. And malaria and cholera, there's no disease in any of the rest of the Caribbean country. And now we all face, even the American coast, facing the menace of cholera and the menace of malaria because of the bodies, dead bodies, has gone to the sea. And the trains bring those to their shores. So then, as global as it is the world today, there is no borders for the disease. There is no borders or limit or special privilege to any kind of citizen according to the control of the disease. So that when we raise the alarm in one country, it should be raised in the entire planet, but we see that it's not like this, no? There is no sometimes support of researchers, there's sometimes competition about the drugs or the medicines, and this has happened to us with our bacterial Israelis, we call Bactibet. Cuba's produced this Bactibet with a lot of effort because we had the mosquito, we had the tropical condition, but we haven't the dengue. The dengue was introduced to Cuba as a bacteriological attack in the 80s. So it was a political priority for our revolution to control the dengue because it was an attack and it was totally new for us. So then all the resources of the state come, emerge in the center, and there is a group of strategy. For example, it's not the same, the strategy when you have a peak because of the raining, there is a peak in the people's contagious. It shouldn't be the same when there is nothing disease, but you know that your country could be affected. You have to have a second strategy. Well, some authorities, when we come with our products, says that our strategies are expensive, that our products are expensive, that it lasts many short days. And when you look into why this is false information coming up, because those people who spread it are linked to another chemical product, to other products, and they want to sell their product. So we always keep and say, no, there is different condition. Even some country has their own resources, their own centers, their own products, but our products is not in contradiction to any other products. And that is the strategy the Cuban follow. We don't have the water that you have, so then this allows, for example, the rural area, the less contagious possibility than Sri Lanka, because they don't have that water. So the few that we have to have covered, we have to protect, even we have treatment about that, and it's easier to clean the areas. But first, this is an effort in which we integrated the entire community. The housewife, the children in the school, the teacher who teach the children, and even some small details. You get an egg, you break an egg, and you leave the egg, like this, raining, and nobody remove in 1 week, it will be mosquito there. So a simple information to the children. Break the case of the egg. The children, they are very emotive, very active. They collect in the entire town and the entire community, breaking the eggs. One of the cases of dengue who spread in Spain was a tire who came from Brazil. The empty tire, it was raining, they were in the shipment, and they covered the mosquito there. When the mosquito was opening the entire shipment, then there was dengue among the harbor workers there. So what I want to transmit is sometimes small details, small information to the entire population prevents huge amount of expenditure in the control of the disease. And of course, we have a program where we have people who go house by house, giving the flask of the Bactibet, put it in water, that then people can drink that water without or boiling the water, no problem. We have the children participation in the school, and we have of course, the preventive system of the disease, which is important, the cleaning of the area and the control of the water. And this is also linked with other disease. When you control the mosquito, you control also other diseases as the dengue is. But what I wanted to raise also the question is that once there is in Africa, and the Africa is spread to other areas, there is no area who will be safe for that. Last year in Singapore, the highest level of dengue was there in entire Asia. Singapore is a rich country, but with huge number of immigrants, and they don't take measures because they think that they are totally cured about the disease. So the preventive works allows first less use of resources in hospitals, and of course preserves the health of the people. Second, it is useful for entire system of health because you not only prevent for the mosquito, you prevent with hygiene for many diseases. And third, the integral participation of the community, seeing children, a house, professor, and all the society alert of how to control those diseases. This is the basic of all the system, health system, public health system in Cuba. Preventive. Why? Because it's more expensive later to cure, and also because it is the entire participation of the society on that. Of course, there is a difference among the public health system, and sometimes the preventive experience are no same fruitful, no? I don't know when I explain how we display a lot of people knocking the door and giving the flags. Some people say, no, this you can do it because in any case you can call the army, but if we put the army to do that, they will say that it is a violation of the human rights. Well, but this is very peculiar because in our army, if there is a disaster, nobody will be making any meeting if there is no the head of the army in front of that meeting and telling the doctor, what would you need? What would you need? How many men do you need to distribute the medicine? So it is according to the cultural tradition in each country, no? The army is ready to distribute vaccination, to put their tanks to spread the chemicals. In other countries, they do to oppress the people, to oppress the student. So they won't feel confidence of them, no? But this is why, besides the cultural difference, besides the particularities of each country, everybody has to be concerned that something has to be done, not thinking only that it is safe from that. No, there is no safe place in the planet to any disease, first, and second, that it has to be for the entire humankind. I could say, for example, that the public health system has many achieved. I think most of them, you know that, for example, we have the 13% of our national product destined to health. The number of the doctor is places in another way than in another country. There is a municipal work. There is the house. The doctor is every 100 people in Cuba. And of course, this facilitated a control not only for the dengue, for the pregnancy women to distribute vitamins and iron for that, facilitate the control of the small children, the vaccination. Why? Because there is a nurse every 100 people and a doctor. Then you can vaccine easily. In other countries, this is not so easily because, of course, our population is only 11 million. And then there are things that are impossible for our population and not easy for other number of population. But what is possible for everybody is that the politician has to be concerned of the use of the resources in the less expensive way, and that the society has to be alert of what is the way that they are ready to control not only dengue, the maximums of health, the disease that the humankind is facing. Well, what to say about TB, tuberculosis, no? People do not associate it as the present situation, but it's linked with what the people eat. What is the environment, the cleaning of the environment? If it is everybody together in the same house, there's no space. This normally happens in the lowest status of the society. So when you think in a program, in a preventive system, those disease also appears. And there is a social, political approach, and an economical also vision of how to tackle one disease. I don't want to get more of your time because I know all of you have a lot of work by your own, and I thank once more for the opportunity to express what we do and also to present some reflections about this topic. And again, reiterated my congratulations for your role, the active role is in our hands, not only for you, your family, but also for the entire humankind. Be conscious that the health is a matter of everybody. Be ready to maintain the humankind alive. So thank you very much. Okay.